Hi everyone. Today is our last day of reviewing content before we start moving into exam review. So I wanted to go over some of the activities I've assigned to you during this remote learning experience to just cover some of the common mistakes I saw in some of these activities and make sure that you are prepared for your exam. You are going to be able to use your notes during the exam, so things like these activities would be great to have printed out and ready for you to reference quickly. But the majority of the exam is going to be expected. It's going to be expected of you to be able to answer the free response questions with very little referencing. We'll talk to you a lot more about that tomorrow, about what's going to be expected of you on the exam. But let's just go over quickly types of therapy that are used to treat mental health illness and behavioral problems. Okay, so we have psychoanalysis. So whenever you hear psychoanalysis, the main word that you should associate with that is the word unconscious. So the psychodynamic and psychoanalysis therapists really try to look for underlying causes for people's behavior and address that. They use free association, and that is basically when you sit on a couch and use ramble, ramble, ramble. That's a great way that these psychologists think that they can access your unconscious, and then they can decide how to help you address the areas that are really causing you to behave in a certain way. There is criticism of this theory on therapy, and one is that there's not really a valid way to measure whether it's effective or not, and also it's very expensive because some of these sessions take a long time to delve into things that happen in your childhood, things you've experienced that you may not even be aware of, how it's impacting your life. So they are expensive sessions, over the course of time. Insurance sometimes doesn't want to really cover that. Okay, so that's one of the common topics that come up with psychoanalysis. Then you have cognitive behavioral therapy. This is also abbreviated as CBT. This is really, really very effective method of therapy. What it does is it helps people change their maladaptive behaviors. That's the behavioral part, as well as their irrational thinking. So a lot of you down here at the very bottom, we have cognitive therapy. And you'll notice the difference is that cognitive therapy is intended to help patients recognize their irrational thinking and eradicate it, whereas cognitive behavioral therapy specifically has the patients focus on their maladaptive behaviors. It helps them regulate their emotional experience, and it helps them come up with actual ways to cope with skills and issues. So let's say this is really commonly used for things like anxiety, and let's say anxiety leads you to procrastinate, it leads you to avoid social situations, things like that. That's cognitive behavioral therapy is often used to address those types of issues and help a person identify what the cause of the behavior is and address that on that level. It's very effective, very it doesn't have to be like long-term therapy, and it's useful for that type of treatment and problem. Okay, then we have client-centered therapy. This is what Carl Rogers, you might remember him. He is from Unconditional Positive Regard. This is a humanistic approach. Humanistic psychologists, if you remember me telling you about them earlier, they were coming off of the whole behavioral psychologist thing where everything had to be observable in a lab, and humanistic psychologists were more looking at the human as in the big picture. So they really wanted to see, we wanted to approach, this is a really really important phrase, unconditional positive regard. They approach their therapy sessions by letting their patients, and they don't actually call them patients, they usually call them clients in client-centered therapy, so that should be changed, but they really have like an equal partnership with the client in terms of the therapy, and they help the person talk through their issues, and they have the therapist has active listening, and they help the patient come up with their own solutions. So you're not going to walk into a client-centered therapy session and tell the therapist, I hate my boyfriend, what am I supposed to do? That's not how it works. The client-centered therapy is really about having the patient talk through and come up with their own solutions to their problems. And that's one of the effective techniques, because it helps the person then in the future, when they encounter a similar problem, come up with their own solutions. So that's nice, effective therapy for that type of problem. Then you have rational emotive behavioral therapy. This is when it's kind of similar to cognitive therapy, but it's exposing people's irrational thinking, because it takes what their emotions are and their irrational thoughts, and it kind of exposes it. This is a little bit more aggressive than cognitive therapy, and that's why it is one of the most controversial types of psychotherapy. So that's what you should know. They kind of make people really go into their emotions and why they believe in they're having those emotions, and they expose it in a way that's usually negative and very aggressive. So it's very controversial. So, but it's effective for some people who really need to hear it, straightforward. So then we have systematic desensitization. This is different than exposure therapy. Please make sure you know the difference. Systematic desensitization. Hear the word systematic. That means systematically, very baby step by step. They expose you to what you are fearful of or anxious about, and they train you to pair those triggers to a feeling of calm. So you will have like a meditative experience while you are seeing something you're fearful of, to start changing the neural connections in your brain to make you not associate that trigger with the feelings of fear or anxiety anymore. That's a systematic process, baby steps. Okay, it's also called graduated exposure therapy, because slowly they introduce this to you. Okay, so this is different than, I'm going to skip over token economy for a second. Go down to exposure therapy. Exposure therapy is what we saw kind of in that video with the spider during the course, where the feather, where the guy took out the feather and the woman was having a really extreme reaction. This is exposure therapy, okay? It's also called flooding, where it's one of the most effective ways to treat phobias quickly. It is just exposing the person to what they fear and having them habituate to it. Then they will remember, habituation is where you keep being exposed to something, but then you realize nothing bad's going to happen, so then you kind of go with it. Remember the mouse in the Skinner box? They kept doing that loud beeping, and at first he was scared, but then he habituated to it and realized it wasn't really something to be fearful of. That's an example of exposure therapy. Okay, so now token economy. Token economy is just think a token. You're given a little token. You're given a reward system, and that's used in institutions to reinforce desired behavior. So you'll see token economy in like an institution where people are living in a place to receive mental health treatment. They're rewarded. So let's say you take your medicine for 5 days in a row and you go to lunch and eat your lunch 5 days in a row. Then you get a token so that next time we take a trip to the bowling alley, you can come. So that's really often used in an institutional setting, and it is pretty effective, believe it or not. You'd be surprised how motivating it can be, and it does help patients often stick to a routine, even though it's a very minimal reward. Okay, so then we have group therapy down here. The group therapy is when it's very effective in family therapy sessions, because usually sometimes if a child is struggling with something, it's not really as easy as just treating the child. The child is part of a big dynamic family, and there's a lot of moving parts, a lot of emotions, a lot of personalities. So sometimes group therapy is very effective for helping patients feel not alone in their disorder. It helps the family learn about the child or person in the family, whoever the person may be. It could be a father suffering from depression, or mother suffering from anxiety, or whatever the case may be. When there is a group therapy session and setting, it's nice because every member of the family starts to get some information about what their loved one may be experiencing, and it also helps them understand their own role in the treatment of the person who is struggling, because it really does take a village sometimes to help people get through some tough times, as we can see right now. And group therapy helps kind of like push people into a forced setting sometimes, but it does help their experience with the whole process. Okay, so that's therapies. Quickly on to motivation. All right, the names, once I go through them quickly, you'll see that they are kind of pretty easy to think. Instinct is unlearned. Remember, instinct is when you are born with the knowledge to do something. The only time you're really going to see instinct in terms of motivation is with newborns. Okay, everything else after that is a learned motivator. So typically, instinct is really just talking about those inborn instincts, reflexes, things you learned about when we learned about reflexes. Okay, then you have drive reduction. Just think, this is a physiological need. They always will tell you it's a physiological need, such as thirst, hunger. That's basically it. I'm just going to tell you. It's basically usually thirst and hunger. And when that need, that physiological need, triggers a drive in you to reduce the need, that is a motivator. So here we have Betty. She was outside, 90-degree day. She's really motivated to get inside. She's going to be irritable until she drinks some ice cold water and the heat is reduced from her experience. Okay, then we have incentive. This is like sort of like reinforcements. This is when positive or negative stimuli motivates us. This little boy wants to go to potty just because he wants M&Ms. So there's an incentive offered. So he is motivated. Remember, these are all theories of motivation by the incentive. All right, then we have optimal arousal. So this is what explains behavior. Why are people motivated to do really risky things and that we don't need for survival? From an evolutionary perspective, there is no reason why you should go skydiving. There's no reason why you should go mountain climbing unless you're like searching for food, but you don't need to encounter such risk for survival. So optimum arousal theory attempts to address the people who want to do things just because they want to be happy or aroused or excited, and that's quite a thrill. So sometimes people just want to do that. Here their example was Frank takes on charity work so he isn't bored at work anymore. I don't know if charity work is really the thrill that they're usually describing in optimal arousal theory, but the key word here is he was bored at work, and to reduce that boredom, he was motivated to do something enriching and to give him some happiness. All right, then we have Maslow's hierarchy of needs. This is a triangle that you see. You have physiological needs at the bottom, and then slowly you move up the hierarchy. The most important thing is that the top of the triangle is called self-actualization. So if you hear that, that means that you have all of your needs met, and eventually you have reached your prime self, and that's called self-actualization. Okay, but what always comes up with Maslow is we know that this is not so easy as like a step-by-step process. Sometimes these steps up here get interchanged, and sometimes people don't really need certain steps. But what is most important and what always comes up is that you are not really able to worry about having other needs met until your basic physiological needs are met. So this is health, this is food, shelter, water, safety. Those are your basic needs. So here you have 6-year-old George. He's unable to focus at school. He can't worry about these higher needs of education and things like that because he didn't have any breakfast in the morning. It is very difficult and he can't get glasses. It's very difficult to see. He might be hungry. And when you're in that state and you're not having your basic needs met, it is very challenging to worry about these other needs, and that is what Maslow's hierarchy of needs explains. And lastly, we have cognitive dissonance. Remember that video? There is an inconsistency with our attitude and our behavior or our circumstances. So when you feel a certain way, but your circumstances make you act in a different way, you will experience cognitive dissonance. And we are driven to reduce that anxiety. We don't like that feeling that we aren't in control of anything. So we have to do something about it, and we have to change our behavior. We're motivated to reduce the inconsistency between our behavior and our circumstances or our beliefs. So here we have Alan. He wants to buy a brand new truck, but he lacks a credit score, so his circumstances do not allow him to do what he wants. So to reduce that anxiety that he's being caused, he's going to work on improving his credit score. Okay, so when you're motivated by the cognitive dissonance and the unsettling feeling of not being able to do what you want to do, you will behave in a certain way to change that, to reduce that anxiety. Okay, and last, let's talk about emotion. The only one I really want you to care about is the two-factor right here, two-factor theory. And this is the biggest part. that makes it different than the other ones, and this is the most accepted theory on emotion. What is really important is this is when the little kid falls, he looks around to see if people are looking at him, and then he decides if he's going to cry or not. This is a subjective experience. If everybody is laughing when the little boy falls, then the little boy usually laughs. If everyone was running over to see if he's okay, then he will cry. And that difference in his experience, whether he's going to laugh or he's going to cry, depends on his interpretation. There's a split second that doesn't seem instinctual to us, but it does exist. And when you have your body's response, you have a split second to think about what you're feeling, and then you experience it. So this is very important to CBT therapy that we talked about before. You encounter an experience, you have an interpretation of it, and then you respond. So this is very important to therapy, this piece right here. Okay, quickly, you're going to have 2 RFR keys on your final AP exam. So, not final exam, your AP exam. So this is a nice example. I'm not going to go through it for time's sake because I just want you to be able to watch this video and move on with your life. So please take a look at this later. It is a great example of something you might see on your AP exam. And tomorrow we will start actual exam review.